I'll turn it over to you, but I want to thank everybody for coming today. We're looking forward to a great webinar today. We'll be having a panel discussion with some time for questions at the end. And let me ask you to please type questions into the chat so we can keep track of them and be able to get to as many as we can. Before we get started, I wanted to give you some background on this webinar series. My name's Neil Halpin. I'm a professor of pediatrics, public health, and public policy at UCLA. And I'm the PI for something called the Life Course Intervention Research Network. Our network is funded by MCHB, and we have over 100 active researchers across 9 different research nodes, and a wider listserv of members of more than 2,000. We study how and when to intervene to improve children's health and developmental trajectories, not just in the short term, but over the entire life course. We now understand just how important families are for children's health. In the past, the study of family processes, family health, family function, family resilience, and so on has been really quite separate from considerations of health services. But this very short-sighted view clearly needs to change. And just a note, as our network has developed over the last 4 years, whether it's focusing on ADHD or on, there's a note on ADHD, there's a note on prematurity, and several others, what always happens is the role of families just rises to the top as being something that's really important and oftentimes controlled for, but not actually examined in its all important ways. We hope this series of webinars will start the conversation we need to have around how we can better understand the health challenges that families face, the processes and mechanisms families use to try to overcome those challenges, and how we can intervene at the family level in order to improve health outcomes. I'm now going to hand over the webinar to Todd Jensen, who's Assistant Professor of Social Work at the University of North Carolina, who leads our family measurement node and is going to be moderating our session today. So Todd, I'll hand it over to you. I'll mute myself. And
Great. Thanks so much, Neil. Such a pleasure to join you all. Another big thanks to all of you who are joining us. I'm so pleased to be joined by 3 wonderful panelists. And I'd actually, just before we jump into our conversation, would love to give each of them an opportunity to provide a brief introduction of themselves, if that sounds okay. I'm just looking at my boxes here. Clarissa, could we start with you by way of brief introduction?
Sure thing. My name is Clarissa Hoover, and I am on staff with Family Voices. So I'm here kind of representing the family perspective. And I just wanted to say my background is as a mother of a child with special healthcare needs, or rather a recently launched young adult. So some of my examples may be more medical in orientation than, so I just want to say up front, it applies much more broadly than that, even if I start going into that groove. And thank you, Todd.
Excellent. Thanks so much for joining us on the panel. Allie, could you jump in next?
Yeah, I'm Allie Crandall. I'm an associate professor in the Department of Public Health at Brigham Young University. So I look at this from a public health perspective and have done quite a bit of work on family health and how we measure it.
Excellent. Thanks for joining us, Allie. And now Luke.
All right. Hi, I'm Luke Russell. I'm assistant professor at Illinois State University in our Human Development and Family Science unit, which is, if you're not familiar, kind of a combination we draw from psychology, sociology, a lot of the health sciences, kind of how do intimate relationships, how do those kind of close family ties or sometimes distant family ties kind of shape how people grow up and how they do well. My particular interest is in how do we serve structurally diverse families, so divorced families, step families, cohabiting families, all sorts of families, particularly in healthcare contexts, but also in schools and government as well.
Excellent. So glad to have you here, Luke. So I'm really looking forward to the conversation, and we really structured this to be very conversational. And so I have some prompts or questions kind of in front of me that will be kind of anchoring our conversation to. I'll probably try to balance things hopefully well, where we make our way through some key themes we want to emphasize while also not disrupting really good organic discussion. And I think something what we can really be sensitive to and orient ourselves to throughout the conversation is, in everything that we'll be talking about, when we really tap into the perspectives of families themselves, the populations we endeavor to serve, whether it's through our research or through our practice, through our development of interventions and so on. How does that shift our thinking? How does that shift the conversation? And so this kind of idea of family voice that Clarissa spoke to just a brief moment ago, I think that can be a real heartbeat to this conversation. And so we'll probably be alluding to things of that nature as we talk. So let's go ahead and jump in. I think to start, we'll be kind of up in the clouds a little bit, a little conceptual, as many academic folks tend to gravitate toward maybe quite naturally. And we're going to try to kind of inch our way down to earth and get practical in thinking about what does all this mean for developing some sort of practice or approach or an intervention intended to serve families across the life course and promote health. So to start, here's a question that we can all think about and talk about. So what are some common terms or concepts used to describe families? These could be family conditions, family processes, family outcomes. And to what extent do these terms have consistent or widely accepted definitions? And I can be wholly democratic here and let anyone jump in who'd like to just get us started.
I'm happy to start, and that by no means, that probably means I know the least, but I think when I think of there's a lot of terminology we use out there, but I think a lot of them can be grouped into the terms of family function or family functioning, family health, and family resilience. And I actually created a slide that kind of groups these definitions together, since Todd let us know he'd be asking us this question. So if I can share my screen, I will actually, it's not enabled, so I won't show that, but Mary, let me know if that becomes enabled. So for me, and looking at the literature, family functioning itself, there's decades of research on that and a lot of different definitions, but in kind of going through all those definitions, it talks about family functioning as focused on task accomplishment. And so anything that helps families' abilities and processes to accomplish the basic tasks, developmental tasks and crisis tasks have been sort of areas that a lot of people have focused on. So think of that functioning area as task accomplishment, versus family resilience is more focused on the family's ability to weather adversity and then rebound from adversity with greater ability to thrive through positive adaptation and growth. I think where it gets a little bit tricky is with the family health, because it's been a term that's been thrown out in the literature, but never hadn't been really defined well. And I served on a panel with Dr. Ann Riley, who brought together a team of experts from around the country working on family issues from a variety of fields to say, what do we mean by family health when it comes to that? And the definition that the team came up with was that it's this family's physical, social, emotional, economic, and medical resources And it arises out of the individual member health and family interactions, capacities, and processes. And I think what makes it a little different from functioning and resilience is it's looking at, just like with individual health, we look at these different buckets with physical, social, emotional, and so on. And it's seen as sort of this resource, but then we have to throw in at the family level that you're dealing with interactions and capacities. And Mary says that I might have screen sharing ability now. So let me share this with you right here. So these are these definitions that I pulled together from some.
Allie, I think we're seeing the wrong screen. I'm just seeing a Windows logo.
Oh, well, maybe I'll just stop sharing then. Because it shows that I'm showing my screen. So maybe it's not working. That's okay, technology. But I think some of these key domains, I think there's overlap in these areas. Like all three of these areas look at some of these social and emotional health processes, but they look at it in different ways. With family health, it's more of this resource that, in my mind, leads a family to be able to accomplish its task and become more resilient. And then those things may lead to even a more healthier family. And with functioning, that emotional and social is all geared towards that task accomplishment and resilience to sort of weathering adversity and growing and adapting together. But that's kind of my summary of it's what I see as sort of three key dimensions of the family that are often measured.
Right. And I think in that response, you're starting to allude to the fact that if we were to kind of craft a Venn diagram, everyone in this webinar together, and we have these kind of key concepts, we probably could start to see a pretty overlapping Venn diagram, but we might also start making some hypotheses or ideas about how these are related to each other. And I think in your response there, you noted a belief about maybe family health is something that could undergird or be foundational to these other family concepts that we might want to promote that can then feed back into health. So there might even be kind of these feedback loops here. But I'll hop out of the way and let others jump in.
Yeah, I mean, I guess just something I'd add on this is to Allie's point, like there's a lot of diversity in these things, right? Like you get 2 or 3 people who study families in a room, they'll give you 15 definitions of what a family is. These things are contested, and the answer is probably there's lots of ways to be healthy. There's lots of ways to achieve different tasks, right, or bounce back from difficulties, and that might look different, right, for individual families. On the other hand, we also have decades of research about, in general, what tends to work better or more consistently for some folks, and I think there's some usefulness in being kind of broad, I think, and being flexible in our thinking about these things. But there's also some dangers in being too broad, right? If a family, the main task is I want to do methamphetamines all day, right? Like that, the fact that you're really successful at accomplishing that task is not necessarily healthy, right? So I think there's, some complexity here that's important to kind of recognize, but that does sometimes make it hard to here's the one survey question that'll help you answer this or capture this concept. And it might look different, right, from situation. What works really well for one family that loves to talk about problems and share their emotions and kind of bounce things back might actually be really overwhelming to some other families or some other individuals who prefer, space and kind of working through things on their own. And so I think that's hard to capture, but there are ways to do that, right? Kind of asking people about what do you do in your family? What's your ideal? How do you feel about the way your family works can sometimes get at that.
And so I guess one of the terms that I think of a lot when I think about families is coping. And I mean, like the family is like the coping structure. It's how we cope with life. I mean, that's I mean, that makes it sound really clinical, but I mean, it's actually really profound to the way those relationships function. And I think it's really important, you know, speaking from the family perspective, the medical perspective, to keep in mind that families are play such a huge role in how individuals cope with just the routine challenges of life. And I've also had people tell me that they don't really like that term or don't really like to have family reduced to that. But, you know, like I said, to me, that's like really profound, because to me, coping is really profound. Another word for family is just, you know, or for what we should be measuring about families is living. I mean, it's really kind of all encompassing in terms of the roles that they play in our lives. You know, in terms of the more like measurement oriented definitions, I personally like family resilience. I think we'll be getting into this a little bit more later on, but you know, for me, it's always the goal in recognizing this concept and measuring this concept is giving visibility to all of the things that families are doing. And one of the big reasons for that is so that we're not undermining them in what we're doing. You know, when my daughter's doing something through the school nurse and the school nurse wants to do it the same way every single time because she's got all these kids, and that ends up changing up our routine every single year because the school nurse is changing every single year, that's, you know, we're the ones who are dealing with this 24/7. Like, I know she's got a hard job, but she's still only doing that job 7 hours a day, 8 hours a day. And I'm doing my job 24/7. So I'm not sure that it should revolve around her. I mean, that's getting a little bit further down the road in terms of some of the other questions you're going to ask, Todd. But I mean, like, to me, it's this really, it's very much a functional thing, but the functioning is so profound. It operates on every levels of our lives and communities. So how do you capture that with any one concept? You don't. Of course you don't.
Yeah, this is really helpful. I'm just kind of making note of some of the concepts that you all have kind of tipped your hat to. So family health, family resilience, family functioning, family coping, family living. One I've encountered as well, family stress management. So there's a lot out. Anything we want to put on the table that's not on the table yet? I don't think we have to be exhaustive, but just anything that's still kind of floating out there.
I think you have family communication, family processes, a lot of these things. And some of them I feel like are kind of under these maybe broader umbrella terms, functioning, resilience, and health, though I think you could pull any two academics in particular together and we debate it out, maybe not very helpfully. But I think there's just tons of terminology out there, which has led to a wealth of information, but also I think a wealth of confusion. Like, what are these things and what do they mean to actual family life and to what I'm doing with my family, and whether it's to an intervention or policy making or a research. Like, I think it deserves some attention. Are all these terms useful, and why or why not?
Yeah, and I'm kind of tracking the chat here as we're talking. An attendee throughout. Family resource management is another concept maybe we're considering. And there's also this point here: the definition might change as children or individual family members grow and get older. So we might think about these concepts differently. I think there's a lot of merit to that. And Allie, some of what you're saying there, I think segues us beautifully into the next prompt. So, and that is, what might we gain by clearly defining these terms and concepts? How might those clear definitions be beneficial to the work we do, to the families we try to understand and serve? Is there something of value in that pursuit of kind of conceptual clarity, where we can take some of these concepts, put them on their own kind of neat place on the shelf with a particular usage that we can bring out to inform what we're doing? What thoughts do you all have about that?
I think that from a family perspective, I think about it as an exercise in transparency. And definitions can also obscure the meaning of what something is for people who aren't part of the whole conversation. So I would go ahead and put that out in the front of it, is if the definition is completed in conversation with lots of different people who are going to be dealing with this issue and from lots of different directions, then it can be used to bring all of those conversations together.
It can be, it sounds like what you're saying, it can be an object that can kind of unify all interested parties. Like if I'm hearing a family describe something and I might say, that makes me think of this idea of family coping. Let me offer some more information about how I understand that concept and see if this is useful to you in thinking through how you want to function as a family together, that sort of thing.
Yeah, I guess I'm thinking of the process of developing the definition as being a grounding exercise as well.
So this is maybe
not just having the definition, but yeah, getting there.
Working with family to co-develop a working definition that's optimal in that setting, perhaps, and brings the voices of those individuals into the development of that definition.
I'm thinking there's value in also creating things that are really practical, right? Rather than inventing new jargon, right? That is kind of obscure and hard to make sense of. And saying, hey, when families spend time together doing something they like with one another, right? That benefits whatever, your heart rate. That being really precise in our terminology is helpful, but also, being careful about using some terminology and instead looking for what does it practically look like. And again, I think working with actual families can help you do that, right? When we're creating our measure or whatever.
Right. So for anyone in the webinar who's more kind of in these academic or research oriented settings, maybe we can save the debates over the precision of language and definition for our recreational academic discussions with colleagues. Maybe with families, we don't let the language get in the way. Maybe we can simplify things, distill things in a way that can be accessible to families, and we're not so worried about, well, technically, I would define that this way, and have not be swayed by those temptations to draw from whatever literature we might be familiar with necessarily. Am I tapping into the sentiment there a little bit, or have I sprinted off in left field? Thumbs up. Okay. Other thoughts on this?
Yeah, so I have a couple of thoughts on this. I do think it gets tricky, but I think when we're really clear about what we're trying to do, whether it's an intervention or whether it's research or whether it's clinical services or surveillance, that a couple of things can happen. We can be, Clarissa used that term of transparency. This is what we're trying to help a family with, or what we're trying to serve our population with. And this is what we're not doing. And related to that is we don't want to take over the family's responsibility, especially in a population like the United States, where we feel like the family is sort of this private, sacred space, and this concern about, will government, and this is maybe this public health perspective, when I'm thinking large population-based services, it's not that we're trying to take over the family, we're trying to support and help and work with families. So if I know, okay, right now we're working with the family to work on coping specifically, or strengthening resilience in our community, those things can be important when I'm clear on what it is that we're trying to do. So kind of lending clarity. The other thing I think can be helpful is when we differentiate these terms, we can, maybe a family struggling, every family struggles in some ways, and we can talk through where they're good, where they're doing maybe really strong. Like, hey, you are really good at adapting to this adversity, but we want to focus a little bit more here on maybe some of this family resources that you need. Or maybe the functioning's pretty well, but maybe there are certain roles that aren't being fulfilled. And so we're able, when we can point out what families are doing well, and then where they can work, I think that's kind of a hopeful perspective that encourages and can drive positive change, rather than our families are dysfunctional, and that can get a little disheartening.
That is, to me, an incredibly beautiful line of thinking. It's how can all of these concepts, assuming there's a unique enough definition for each of them to be distinct and meaningful, how can these concepts aid me in recognizing strengths, not deficits, but how can these concepts give me greater language and conceptual reach to identify strengths when I see them? That's powerful to me. I like that very much. I think that's a great
I want to
perspective.
pull out a couple of things that Ali said as like terms. Like we're talking about family boundaries now. I think that's really interesting to think about at the family level instead of the individual level. And there was another one that you said, Ali, that I was like, that's a thing. Like, you know, family strengths, and I'm sorry if I think of it, I'll like share it, but you know, there's other pieces of this that we could be capturing.
Yeah, definitely. Other thoughts on this? And a friendly reminder to our attendees, if questions pop up for you during the course of this conversation, feel free to track that, throw that into the chat, and we'll try to have time at the end for questions. So definitely feel free to share your questions throughout. So kind of moving into the next prompt, maybe we can speak to this a little bit. Are there specific terms or concepts that you find yourselves gravitating toward because they feel so practical? They drive action. They feel actionable. They can really center our attention and focus. It's something we can really get our hands dirty with in a good way. What comes to mind for you? Are there concepts that really stick out as being especially actionable and pragmatic?
Todd, I struggled with this a little bit because I'm thinking about this public health wise and where it is, but I was thinking, okay, if I'm thinking policy making, like an actionable place feels like are our policies, whether they're a quote unquote a family policy or not, like all of our policies affect families in some way. And Karen Bogenschneider has done some really interesting work on looking at sort of a family impact analysis on policies and how they affect families. But I think when I'm thinking family or with policies, I'm thinking, well, a lot of these policies, how are they affecting families' roles and their ability to fulfill their roles, or their ability to, do they help facilitate role making, or do they get in the way of that? And then I would think of sort of the family functioning area if I was considering that. If I'm thinking about, do policies facilitate resources for families, then maybe I'm going a little bit more on the health place. Or what about, now we're in this time of COVID or post-COVID or something, and thinking of how COVID has really affected families in a lot of ways. So are our policies enabling families to weather storms? Then I'm going sort of this to the resilience, family resilience side. So I think different terms can mean different things at different times. And I'm not sure I necessarily see something as more important than the other. Just what is it we're trying to accomplish and consider? And then hopefully using terminology that's meaningful to the general public or to our policymakers.
Yeah, and as you were speaking, your summary statement matches really well what summary statement was coming to my mind, which was, if I'm to think about a family concept that I'm drawn to because it feels incredibly actionable, why is it actionable? It depends on what I'm trying to accomplish. So what action am I trying to pursue? And so there might be a different concept that is suitable for that action, just as you described, and you gave like at least 3 excellent examples of that. When we might focus our attention on a specific concept versus another, which makes great sense from my perspective. Other thoughts on this?
I think thinking about it from the policy perspective, as Ali mentioned, I think one of the big focal points for me is family support. And you know, like when we're thinking about children's protective services, is it supporting families or is it tearing them apart? And how do we arrive at this place where there's such a negative perspective on parents who are struggling? Like, I mean, I know there's the cases where there's just no ambiguity that the parent isn't intending to be a parent, but a lot of people who end up in that system would actually be much better parents with a little bit of support, or a lot bit of support, as the case may be. And so, you know, I mean, I think that's, you know, when we look at the school system, is the school system, are teachers becoming contentious with families, or are they supporting them? Are their jobs structured so that they can support families? Or are they trying to fit everybody into a box that makes it easier for them to deal with the overwhelm they're under? I mean, it takes a lot of resources to make our system supportive to families. And it's a really good, I mean, kind of, you know, not obviously a litmus test, but a really good criteria. Like, is family support coming out of this system?
Yeah,
I don't know if that makes sense.
I think it does. Well, I come to the table with a background and training in social work, and we heavily emphasize this kind of person in context perspective, where we try to jointly acknowledge kind of things at the micro level, things individuals are grappling with, maybe their families are grappling with, and then also things happening more at the macro level, these kind of policies and systems that exert influence on what's happening at the micro, and seeing real value in really maintaining both of those perspectives and training practitioners to operate at both of those levels with maybe a specialty in one or the other. And so that resonates with me in thinking about families in the context of larger systems, and are those systems engineered to provide families with tailored support or not? And so this notion of family support as an important concept definitely resonates with me.
Or even not so tailored. I mean, sometimes they're systematically and consistently doing things that are really harmful.
Yeah.
I mean, I guess the really painful example there is talking about public support programs that penalize married couples. And they're literally driving fathers out of the home, and they have been for decades.
Mm.
So, I mean, sometimes it's not even just that we're trying to customize. Sometimes we're just wrong when we think about supporting families as a criteria.
Yeah, sure.
Yeah, I think it's critical to pay attention to some of that context stuff, and yet reframing that question, right, rather than saying, okay, what are these kids or families, doing wrong? It's how are we failing to serve them, right? As a health practitioner, or as a government, or as a social worker, right? What can we do to help them, again, achieve their goals, or achieve health, or achieve resilience in a situation? I think just changing that frame of where you're looking definitely can be helpful. The other thing that was coming to my mind as I'm thinking through this, again, we got to be careful about like saying, here's the specific things you need to do to be a good whatever dad or mom. I mean, I think sometimes people value some practical advice, but again, there's usually lots of ways to do this right. What cultural values are we kind of enforcing, either purposely or maybe subconsciously, when we say this is the way to be a healthy family, or whatever. And most of the research tends to suggest, again, there's different ways to do this. What tends to cause problems is when kind of what I'm experiencing and what I want, or my ideal, mismatch, right? And we have some options there, right? We can then change what you're experiencing, try to make it more like the ideal, or we can maybe change your expectation, right? That it's okay that maybe my kid is different and has different needs than other kids, or my relationship with my spouse might look different than what I saw in the Notebook or whatever, right? But again, like there's these value components behind that of like who do you push and in which direction? When do you try to meet high expectations? When do you want to push people's expectations up? Of like parenting can't just involve showing up and saying hi every once in a while. When do you need to push those expectations down? And I don't know if there's great answers for that. You know, ideally, you want to, I don't know, interact with the culture, the family in particular, and figure out what can we collectively agree on, right? What do we think is feasible, and what outside resources would we need to get to that place we want to be?
I think you raise a really important issue, Luke, is that we really need families to be our partners whenever we're developing a new intervention or a new policy, or whatever it is we're trying to do, that families are part of that partnership, and that it's not us saying this is what you need, but a discussion together on what's needed and what can really bolster our communities through working with families.
Yeah, these kind of more community-based participatory research methods and similar approaches. There seems to be a lot of value in that. And there's, I think, a lot of attention being placed on those approaches, and that seems to be really promising, really honoring and dignifying the lived experiences of the very people we are hoping to serve. And I do think it's helpful to think of it as service. And when we do, it's really tapping into, yeah, what are your needs from your perspective? What are the issues from your perspective? How can we co-engineer a solution to those problems and test things out and pivot as needed, but do that together? Because yeah, the families have expertise on their own lives. And that seems like a wealth of wisdom that could inform everything that we do.
I mean, and as much as even that comment of like, you know, the parent who just comes in and says hi, you know, if that's all I can handle, and, you know, otherwise I'm going to be violent or causing all sorts of challenges, maybe that is what I should do, right? Like maybe that is the healthy choice, is to only come and say hi. Now, there's other supports perhaps that I need, dealing with anger, dealing with, again, maybe drug misuse or something like that. But I don't know. I think about some research that, you know, sometimes you're better off being an uninvolved parent than like a dangerously involved parent. And I think that raises some interesting, you know, complications to think about. Ideally, we want people maybe to be healthy, but you know, what's that mean?
Yeah, definitely nuance there. That's helpful to be thoughtful about.
As we're talking about this, so I think a lot of people on this call come from a background of like family therapy and having studied families. And for a lot of us in public health and medicine, some of these other fields, we don't always get that benefit of getting education to help us understand family and family theories. And unless we actively pursued it ourselves, we may feel some discomfort, I should say, with, well, how do we reach families? And I think that's led us to sometimes say, well, we're not experts in that. That's for people in family therapy or in the family sciences. And so we're going to focus on that individual level or that community level. But I think we have an important onus, and I've thought about this a lot with public health, that we're training up our public health professionals to think about, how do all of my policies, my programs affect the family? Same within the clinic. I have a patient, or let's say the hospital, a patient comes in, their health issue isn't just this individual thing, it's affected by their family. And so until we train up our practitioners in a variety of fields to really understand the family a little bit better, sometimes we just need to demystify it all. We don't have to know all these definitions and theories necessarily, but we need to have an ecological perspective in understanding how the family fits in. I think then we can maybe do a little bit more.
Yeah, I like where this conversation's going. And so I say we lead into it a bit, because I mean, some thoughts coming up for me with respect to everything you just said, Ali, is one, I think we're seeing this shift towards what we would call, I guess, integrated care, a more holistic view on how to provide health and health-related services to individuals and families, where clinics are actually bringing in multiple professionals of different training backgrounds. And so you might have clinical social worker over here, you have primary care provider over here, and all others. In addition to that, I very much like this conversation about what would need to change in terms of workforce development to put a wider range of practitioners and folks who deliver interventions of some sort to be well situated to engage with this kind of family perspective or systems thinking. I love that the thinking about that. What would need to change? Because I think about this a lot myself, is noticing how different fields approach their practice and how they're trained to look at problems in a specific way and to look at solutions in a specific way. What thoughts do you all have about this? What if we could kind of wave a magic wand and tomorrow workforce development just dramatically changed across all these different service delivery fields? What would we like to see? What would be most helpful in kind of framing things from a family perspective in an optimal way?
So I think on, like, the health, so much, to Allie's point, to Clarissa's earlier points too, like so much of health care and health work happens in the family, right? Chronic illnesses and things are some of the most prevalent sort of conditions that exist. That work is not happening in offices, right? It's happening at home. People are preparing meals or providing care, or sometimes emergency acute interventions and elsewise. And that requires maybe some training for more than just who shows up in the office, which might be one person, and 95% of the time, maybe their mom, their spouse. But if that child is spending time with a step parent or with the next door neighbor who watches them after school every day, or their older sibling, that person also needs to know what happens when an asthma attack occurs, or how to give an epinephrine shot or something. And I don't know, based on the research I've done around divorce, that information always gets communicated to everyone who needs to know it. When I interviewed nurses, they told me they had maybe a paragraph on family throughout their medical training. I haven't talked to as many doctors, but I suspect they don't get a whole ton more than that. I think it'd be useful to have some more one class, half a week, maybe, just thinking about some of these family contexts, because all of your patients live in families. And if I get a cancer diagnosis, that doesn't just affect me, right? That has consequences for my spouse, my kids, my aunt and uncle, maybe my cousin who needs to come help out, right? It has kind of family effects. I'll shamelessly plug here, the Journal of Family Nursing, the International Family Nursing Association tries to combine a lot of this. We have a special issue on how do you support structurally diverse families coming out in November. Todd has a great paper in there on step families and health. So I think there's been a movement to try and have some of this research. Of course, what I know is it usually takes 17 years for that to get into the clinic. I think we need to find ways to expedite that, and get the information out there. Training's probably a spot where it could happen.
Yeah, the no-do gap is a formidable challenge for sure. Because as we know better, there's a lag sometimes in how we do and getting to the doing better. So it's an important point. Other thoughts on this that are coming up for you all?
So I can speak to public health. I think it's important that accrediting bodies for different programs are also recognizing that. So CEEF, who accredits schools and programs of public health, has a little bit of allusion to understanding the intersection between individual, family, and community health. And so we've started up a whole class and a certificate option in our Department of Public Health here at BYU. And I know other schools, Indiana, University of Maryland, and College Park actually integrates their family sciences within their School of Public Health. And there's, I don't want to list anymore because I'll miss so many, but I'm encouraged to see that more and more people are considering this within at least the public health field. And I think it starts with getting it into our curriculum, and usually accrediting bodies of curriculum need to say, this is important, this matters. And so the more recognition we have, then we can make sure we get it into our classes. So we have a full class on it and a certificate option here. But I think then they go out into the field, and if their bosses and stuff aren't seeing the importance of it, that can be hard. So it does take time, but I think it's a start to say, hey, we should consider this, and this is, this is how we can maybe interact with families, or let's get a family perspective about this issue.
I guess one of the things that I'm thinking about is thinking about the systems in terms of how much time families spend with each role. It's often kind of a top-down approach in terms of thinking who we need to influence or who needs to change, but the person who looks most important from a systems view may actually be the person who literally only spends 3 minutes, having a conversation. Okay, maybe not literally 3 minutes, literally like they're supposed to spend 5 minutes or whatever. I think the importance of receptionists is underestimated, like they've set the tone for your visit before you've even walked in. So if they're hostile, if they're racist, if they're judgmental, like that's how that visit's going to go. And so there might need to be more workforce development on, and it's the people who put in the time. Teachers spend a lot of time with your child, and maybe there isn't all that much that the healthcare system can do if the teacher is really not understanding how to support the family. Sorry, I tend to spiral out, but I turn things on their head because of the perspective I'm trying to take, and then it gets complicated.
It is complicated. And honestly, that might be one of the barriers we confront with all of this and trying to move towards these kind of family-oriented perspectives and inclusive definitions of family, thinking about these different family concepts, thinking about families and how to intervene with them productively and promote positive outcomes across the life course. Family life is complicated, it's nuanced, it's distinct, it's idiosyncratic, it's all of those things. And so, and I think, Clarissa, something you're speaking to that is really profound and important is when we think about workforce development and we think about situating individuals well to engage with families productively, maybe we're not just talking about physicians or nurses, maybe we're talking about all of the other staff in the building who have any face time at all with anyone who walks in the door. So that's a critical perspective. And we might think of not unconventional places that don't typically come to mind when we think about kind of life course interventions. Schools, children spend so much time in schools. So certainly homes where family dynamics actually unfold. We should think very broadly about what it means to develop the workforce. I like that a lot. I'm conscientious of time. Oh, Clarissa, yeah. Were you pointing out the chat?
We have a comment from Maria in the chat. Yeah. That I think kind of relates also to some of the things that Luke was saying about making those connections with different kinds of services and thinking about who has the time, who has the resources. Okay, I'm remembering what it was I was thinking about, and you just mentioned time, Todd. I'm sorry. I had a interventionist out at the house who was supposed to be working on my daughter's speech, and what she did instead was tell me, if you guys haven't gone to the park by the next time I come over, you're in trouble. And she's 100% right from an intervention perspective. We needed to, we're so focused on my daughter's medical needs and her medical crisis. We weren't leaving the house. She wasn't leaving the house. We needed to go to the park. She's not going to learn to walk well if she's not playing on playgrounds, that sort of thing. And like for people to have the flexibility to just do like the human thing, like create a relationship and then see the need and then say the thing your mother would say if she was there, that kind of thing. Like that human element in our systems is something that we could potentially foster, but we have to think about what it looks like. Was that a random direction or was that the right direction?
I don't see how you could frame that as anything but the right direction. This kind of that you're speaking to the human relational element to all of this, approaching our work with authenticity, with a genuine nature, with a desire to connect with people, and to have everything we're doing rooted in that desire and that authentic care. People feel that. We can talk about all the family concepts we want. We can be well versed in how to describe them, how to infuse our interventions with tactics that will promote them. We can do all these things. But if we don't have those skills, if we don't have those strategies, those relational strategies, we may not be entirely effective in our work. Whether we're researchers, whether we're practitioners, whether we're educators, whatever role we have. So I love that you mentioned that. I'm kind of getting more and more involved in different areas of research that are interrelated, but it's fascinating to me that every line of research I kind of dip my toes in, I quickly see the value of everything you just described. To do this line of work well that I'm studying, it seems like these relational elements are critical. So I think it's paramount that you gave voice to that. Looking at the chat here, so we're at about 3:24, so we've got about 5 minutes. I know we promised some time for Q&A, and I know we have some folks that have been incredibly engaged in the chat throughout our time together, so appreciative of that. So I'm going to try to just look at some of these comments and see what comes up for our panelists here. I know there was a comment earlier above from several minutes ago, so apologies in advance. Characteristics of positive psychology can be a way to frame strengths for individuals. All people have strengths. This idea is about identifying ways to support individuals and deepening their strengths. It'd be interesting to think about and identify the strengths that can be identified and cultivated at the family level that support function, resilience, and health. Absolutely. I think we should all be heat-seeking missiles to strengths because they're always there. Let's see, this conversation is also pointing towards a need for a more holistic approach, understanding the interdisciplinary nature of health because our interventions tend to focus on addressing a single piece and not looking at cross-sectional interventions. Yeah, again, back to that kind of the fact that reality is complex and so much of our work can steer away from the complexity for lots of different reasons, but there's a lot of complexity here, and I think a lot of value in integrating disciplines and having a kind of systems thinking guiding our work. Yeah, please, Luke.
I thought I'd just add on that, we know people can't do everything, right? And I know that's one of the hesitances. We talked about this early of like, I'm the physician, or I'm the, this is my role, stay in your lane, right? But finding those colleagues or collaborators who do have the expertise you need is something to seek out, right? And I know in the chat, someone was talking about, cooperative extension, people tend to think of it as like mostly agriculture, but there's tons of relational work that gets done through cooperative extension and supports for families, and maybe more likely to be in some of those more rural areas that don't have a whole bunch of family therapists or psychoanalysts or whatever. And so I think it's important to, find out how can I find the person who does have the expertise and training and emotional wherewithal to do this, authentic connection and support for families, and make sure, I'm pulling them in, or I'm helping, connect them to the families I'm trying to help.
Excellent. Thanks for connecting to, I think, actually a couple comments in the chat. That's perfect. What other comments or questions are coming up for all of you in attendance? Got about 2 or 3 minutes left.
I see also from Neil, there was a question about stages of families. And I think it's tricky, you know, the family kind of stage models, developmental models, you know, most folks have recognized, like, people don't tend to always go in that order, right? And, you know, I might be characterized as a family with young children because I've got a 3-year-old, but at the same time, there's older adults in my family who I'm also caring for, right? There's maybe, you know, families exist in multiple stages at once. I think it's important to pay attention to development, right? And to understand, you know, what good family management looks like with the 3-year-old, and curfew maybe looks different than for the 18-year-old or 17-year-old or whatever. I think it's important to recognize the development. I think it's tricky to say this is the stage, but sometimes those stage models, you know, can give us some insight about, like, you know, what's generally going on for a group. I don't know. There's some limitations to stage models too that we got to be conscious of.
Yeah, I think I can echo that piece. Just there can be a temptation towards getting the utility out of kind of a stage-based way of thinking, because it helps simplify what we've talked about as being a very complicated, complex, dynamic, non-linear progression as a system through time, reacting to the system's environment and things. So there can be moments where it's like, well, let's just distill this down very simply for a moment. But I think as long as we can retain that actual complexity at the same time, there's, I think, value in always holding very firmly to the actual complexity and unpredictability of all this. Okay, I'm just taking a peek here. The chat, seeing someone sharing some resources here from Maria. Here's a link to a document that I helped to create. The focus is on family resilience and was designed for extension personnel, but it might provide an example for translating the theory into practice. Great, so we have some resources being shared generously here. So feel free to explore that link. And I just want to thank everyone again for joining us. I also just want to quickly plug our next webinar, which is planned for October 26th. Dr. Froma Walsh will be joining us. We'll be talking about family resilience and really digging into that. Dr. Walsh has done a lot of work in that area, so we'll try to explore the nuance of that concept in particular and the implications of it for family-focused life course intervention work. So information should be sent out to the LCRN listserv soon, so be on the lookout for that. Some additional resources being shared here in the chat. So thank you all again for joining us. It's been a pleasure, and we hope to see you at our next webinar.